Welcome. This is MoneyHeart, where we explore the emotional side of money. I'm Camille Diaz, and today we're discussing market value medicine. Dr. Brian Kent is my guest, and after practicing in Orange County for about 24 years, he relocated to Tulsa, Oklahoma in 2011. He recently published a book called Snafu, which is a parody of healthcare. Dr. Kent, welcome to MoneyHeart.
Thank you.
So give us a little insight here, because there are lots of fields that you could be a part of. What kind of a doctor are you?
Well, I'm a plastic and reconstructive surgeon. I'm board certified, and I've been in practice it's about 33 years. I used to do more reconstructive work, but now it's almost 100% cosmetic surgery.
Oh, wow. Okay, cool. So you told me that you started in Orange County, California, which
Yes.
is, I grew up near there, so I know that's kind of the land of the movie stars, and cosmetic and reconstructive surgery is a big deal. What got you to relocate to Tulsa?
Well, the movie stars are a little north of us, but the economy was changing. It was getting more and more expensive to live there. There were so many plastic surgeons there, and just getting to practice was getting tough. My wife, full disclosure, my wife was born and raised in Claremore. So I've been to Oklahoma, I've been to Tulsa many times. And so for family reasons and for economic reasons, I just figured I better move before I get too old. And now when I see what's going on in California, that decision was looking smarter and smarter. So I've been here 10 years now. And it just, the cost of living is so much less, and that's a real big deal. People are nice, just so much easier to work here. And I'm very happy with my practice situation.
I feel that a lot. We moved in the end of 2009 for exactly the same reason. Cost of living is just through the roof over there, and it was nice out here, and we could get a place. It was close to a school and walk the kids over there every day, and it just made sense. So yeah, we've been here about the same amount of time, and it's worked out really well. Awesome. So how do your patients typically find you? How do you even, you came here, you started a whole practice. I'm guessing most of your patients are local. They probably didn't fly halfway across the country to stay with you. So how did you
believe it or not, I had a few follow me from California.
Really?
One of them, yeah, and they just stayed here in a motel for a week and then flew back. But it's we did pay-per-click ads on the internet. Got a good website up and running, and I was doing search engine optimization and trying to go just internet advertising, and then just working hard for all those years. And then now a lot of it is, word of mouth. And also our pay-per-click ads are really paying off. And we're getting a lot of activity on the internet, a lot of people emailing us. So it's about half and half, I would say, at this point.
Is that something that most doctors do? Run advertising and have their website going and have to optimize for search engines and all that sort of thing?
No, most doctors do not do that at all, but most plastic surgeons do, and have a substantial website, have to worry about advertising, have to decide how much money they want to spend on advertising, and have to worry about that kind of thing. We have a very extensive before and after gallery, so patients will come in and say, well, Dr. Kent, I chose you because I compared your befores and afters to other doctors in the Tulsa area. And they look at that. When I come in as a patient, it's very hard for me to know. I may hear Dr. So-and-so is very good, but you just don't have the statistics of their work. So at least, in cosmetic surgery, at least there's more to go on.
Yeah. Yeah, and I have looked at the before and after on your website. I was very impressed with so much of your work,
Oh, thank
especially
you.
when you do the eye lift, like underneath the eyes, the bags and stuff like that. I can't even see where you made cuts. It's amazing, really amazing. So yeah, super impressive stuff. Um, but that's a great point that, you know, you don't necessarily see that from other things. So I had an ACL reconstruction a few months ago, and I heard that my doctor was good, mostly after the fact. He was referred by another doctor. And then afterwards, people would say, "Oh, who did your surgery?" And I say, "Oh, Dr. Cash." And they're like, "Oh, he's really good. I know who that is." You know, I said, "Okay, great." But there was kind of no information going in other than he had some stars on the, you know, website next to the list of all the other doctors, and that was kind of it. What creates this difference in you having to do so much advertising and other doctors aren't really doing it that way?
Well, uh, a lot of times, um, well, first of all, orthopedics is a little bit different animal, I think.
Right.
They've really got it made as far as, now all those baby boomers are aging, or all our joints are going to pot. And so they've got work out the wazoo, so patients are coming in. They have orthopedic surgeons are in bigger groups. And so, there's so many orthopedic surgeons, and so advertising isn't really something that there's a couple that do advertise, but most do not. But in plastic surgery, usually what they do is paid by a third party, whereas ours is out of pocket, and it's much more competitive. So we kind of are forced to advertise to get patients in the door. But
Right. Well, that's really cool what you said, because one, your stuff is elective, so it's, we probably won't die if we don't have our breasts augmented or something like that. We'll probably survive that. And quality of life is probably better with the reconstruction, but it would be okay. Whereas, like for me, I was going to have continuous injuries and potentially not walk if I didn't get that fixed. And like you said, if your joints are going downhill, you got to get that fixed. You're going to be in pain every day. So kind of super required. But also, you pointed out that we've got insurance covering one where we're paying out of pocket for the other.
Yes, and the other thing I was going to point out is that I'm not like the My Pillow guy. You don't see my commercials on TV every 30 seconds, and there's different advertising. Even though I advertise, it's just like I say, pay-per-click stuff on the internet. There's no TV commercials, radio commercials. So there's other doctors who are much more into that. So that's one thing. But the other thing I was going to say is, when I choose, the one perk of being a doctor is that when I choose someone, I always ask the nurses, the techs, the physician's assistants. I have a friend who's a physician's assistant. He actually works in orthopedic surgery. And I said, who's the best person for doing a joint replacement? And you can talk to the anesthesiologists, the CRNAs. So I have a lot of inside baseball kind of information. And, that's more than most people have when they choose somebody.
Right.
But if you have a friend who's in the business, that's a big deal.
Yeah, that makes a big difference
yes.
Knowing who's there. Yeah. And
we don't have, it always strikes me that you look at professional golfers and baseball players and NBA, NFL, and they have all these statistics, and you can see, the data, all this data of every aspect of their performance. But the guy or woman who's going to operate on you, a couple friends said they were, really nice and everything, and they had a good result, but how good are their ACL reconstructions? How well do their patients do?
Mm-hmm.
So
yeah, because okay, so I do watch some professional sports, and so like if I'm watching, let's say, football, they'll tell me how many times this person has started a game where it was raining, and also they were playing someone from a place where they grew up together. Like it's the most random stat that they will come up with to share. And you're right, when it comes to doctors, we aren't getting that information of how, it would be great to know, okay, with this doctor and they do the ACL reconstruction, the patients are walking again within 6 weeks, and with this one it takes 8 weeks. And so you could figure out, oh, maybe which one of those would be better for me to, that would be so cool to have that info. And I'm sure it's there, it's just nobody's tracking it or putting it together or putting it out there.
I don't think the information's there and nobody's tracking it.
Nobody's tracking it.
I can get is someone who actually watches them in the operating room and, give me some idea of their competency and, how good their hands are.
Mm-hmm.
So, and, bedside manner does matter. And you have to find somebody who also, you get along with and you feel comfortable with. So
that's very true. That's very true. I've had doctors that I've really, really liked and never had a problem making an appointment and going in. And I've had other doctors that I'm just like, oh, I have to see that guy again. They don't really help,
Right.
Can I switch to someone else? Why am I trapped with this person? So yeah, you just never really know until you get in there. You just kind of pick a name off of a sheet most of the time.
Right.
Because your insurance says, well, these people will take our money, so you can choose from this list.
Right. And then we had talked before about who decides how much the doctor makes.
Oh, yes.
And,
how does that get decided?
Well, let me tell you about my negotiation with the big insurance companies over my 33 years.
Mm-hmm.
What they would do is maybe once a year, they give you like CPT codes, and that's how we bill. They say, give us 5 CPT codes. That's all you get. And we'll tell you what we will reimburse you for those 5. So you send them the codes. They send you back the dollar amount. So then it says, if you have a question about this, call this number. You call the number and you get like a secretary and you say, well, this reimbursement's too low. She goes, okay, so do you want us to remove you from our plan? That's negotiations. Take it or leave it.
Wow. That's not really much of a negotiation.
No.
It's more like suck it up, buttercup.
So I just asked my biller about that. And I asked if like even the orthopedic surgeons in big groups have more clout. And no, they get reimbursed the same amount that any orthopedic surgeon would for a given procedure.
Mm-hmm.
So the insurance company dictates how much the reimbursement is. So for instance, just so people know, we had talked about the story of how a patient of mine came in, had a skin cancer on his cheek. And he said, well, how much are you going to make for removing it and then closing the hole? So I said, well, I know that your insurance company pays Medicare plus like 10%. So let me find out. When I walk back in, you tell me what you think I should make, what you think is fair. So when I walked in, he said, well, I think around 3,000 would be fair. And I said, well, I'm going to get paid like $500 for that.
Wow.
And he just shook his head and said, okay. So I think patients don't realize that even though when they look at their initial bill, they may see a number that's pretty high, which is what the doctor billed for, they have to look and see what the doctor actually got reimbursed by the insurance company. So my biller told me that for a hip replacement or a knee replacement, it's about $1,200.
That the doctor gets paid?
That's how much the surgeon gets paid for doing the surgery, taking care of you for 3 months afterwards, with all the responsibility and liability and all that. And a gallbladder removal is $640.
Wow.
So, no, the reimbursements from insurance companies are not what I would call market value.
Yeah. Well, and I'm guessing, knowing what your specialty is, when you closed up that guy's face, you were doing it in such a way that he's not going to have a big ugly scar happening. And that seems pretty valuable to me, probably more than $600 or $500. So.
Well, it's valuable to you, but not necessarily the insurance company.
Yeah.
So,
yeah. Good point.
But I guess you could debate it back and forth, but that's just, I think if you look at how much the doctor actually gets paid, it's actually quite a bit less than you would think in most cases.
Yes, that's true. And I suppose a lot of that ends up going to middle people, for lack of a better term. They've got wherever it is they're practicing is probably taking a piece, and there's probably some people above them, and whoever's running all the staff, and so by the time it filters down to the person doing the work, quite a bit has been chopped off the top. So really
Well,
interesting.
if you look at all the money paid for healthcare, the amount that's paid to doctors specifically is only, I think it's like 8% or 9%.
Wow.
It's
Wow.
a small minority of the total amount of money we pay for, all of healthcare.
Yeah, that's quite a big machine happening there.
And then surprise billing has been, like a thing in the news recently, where you go to the hospital and you have insurance, and the hospital's in network. So you have your heart attack, you go to your hospital, it's in network, but one of the doctors who treated you was not in your network.
Yes.
And then they don't accept this negotiated fee. And then you get this fee that's much higher than all the others. And then they expect you to pay.
Right.
And it's a real mess because, like I just mentioned, the insurance reimbursement is low. So you can't blame the doctor for saying, no, I don't want to sign that contract.
Right. Yeah.
But you can't blame the patient for saying, well, look, I have medical insurance for catastrophic situations like this. I expect them to,
I
pay.
expect it to be covered. Yes.
So I understand both points of view. It's just,
right.
It's a very difficult problem. And so the way they're going to solve it is have a middleman, a arbitrator to arbitrate the situation. But unfortunately, I think the arbitrator is going to be from the insurance industry, and that's the one who's going to be telling the doctor how much their work is worth. So it's not a free market situation.
Yeah, yeah, that's really interesting in that when you're a patient and you're suffering, you've gotten into a car accident or something like that, you probably don't have time to sit there and quiz every doctor or nurse or specialist that comes into your room to say, wait, I have to log in and see if you're in network. That's
No.
If you're broken and bleeding, you need to be fixed. You can't do that. So as a patient, you can't do the quote unquote smart shopper thing and try to go research all of these things. And then the doctor is just going to do the job because all of you are compassionate and want to treat people that need help. And so we all just kind of get stuck. It's really hard.
It is very difficult.
Yeah.
Very complicated.
Very complicated. Very complicated. Well, I'm not sure the best way to simplify it, but I really have enjoyed talking about how it works from the other side. Because I think many of us as consumers, we just kind of see our side and we're like, oh, everything's too expensive. But when we look at it from your perspective, we really see what the doctors are getting, what they're not getting, where the confusion is. That's really cool. Well, I appreciate that.
And one thing I heard that I think is a positive thing that I heard from Clark Howard, the consumer advocate, is that if you get one of those surprise bills or a bill from the hospital that's difficult to pay, you can always call up their billing department, and often they're willing to negotiate. And that's been my personal experience.
Yes.
They'll talk to their manager and then they come back and go, well, we'll chop your bill in half, or, so it's always worth making that call.
Yeah.
And I think that's a positive thing to do.
Yeah, I think that's great advice for consumers, is to make that phone call, figure out what you can do. Sometimes they'll give you less if you're paying up front. If you need to do a payment program, they'll usually let you do that. I actually called to pay off a piece of my surgery, and I said, yeah, I'd like to pay that. And she says, all of it? Like, it's like $700 or something. And I said, yeah, can I pay it now? And she goes, did you need a payment plan? No, I just want to pay it. It was almost hard for me to just give them the money because I knew it was coming. I was ready to pay it. And they were very surprised that I was attempting to pay something. It was really weird.
Yeah. And I think they're for the most part, they're willing to work with you, in most cases. But the other thing I was going to talk about is transparency. If you call I had to go in for a X-ray study, a barium swallow, and you swallow some barium. They see if you have reflux, from your stomach, and so I called ahead of time and said, well, how much are you going to charge me? I was being a good consumer.
Right.
So they told me. And then when I got the bill, it was like $150 more. So I called and said, wait a minute, you told me it'd be X amount. It was 150 more. So she looked it up. She goes, well, we didn't add in the pharmacy charge. And I said, well, pharmacy charge for what? She said, the barium. So in other words, when I call it to get the price of the barium swallow, they don't include the price of the barium.
The barium. Yeah. The key ingredient.
You just shake your head and go, even though they talk about having transparency in healthcare, I think we're pretty far away from, getting an accurate, idea of what something's going to cost. Yeah. Unless you go in for cosmetic surgery, because if you come into my office, I will tell you what I think, I would do for you. And then I give you a surgeon's fee, a facility fee, and an anesthesia fee. Mm-hmm. And we put it in writing, and they get a copy, we have a copy in their chart, and that's exactly what they get billed, or what they pay. They don't pay a penny more than that, and that's it. So it's extremely transparent. That's the good side of, cosmetic surgery.
Yeah, I like that. We know, what you're getting, what you're going to pay. The plan's all worked out ahead of time. You pay it, you've received your services, done.
Right, and it's free market. So if I charge too much, they can go to someone else who maybe charges less. And
right.
They think they're getting a good deal with them, they can go with the other plastic surgeon. So
I'd look at those before and after photos. Sometimes a good deal is not a good deal.
I always skip, whenever I talk to another plastic surgeon, I'll look at their website, and I don't look at all the other stuff. I like you, I always go to the before and after pictures, and I look and see, and that usually tells me the most.
Yeah, especially because I bet you know exactly what to look for.
Yeah. Mm-hmm. And it's nice seeing if they have videos of themselves, talking, get a little idea of their personality. And so it's nice having that. Usually when I go to see a doctor, that's not available. Most don't even have a website.
Right. So, yeah, very true. Very true. Tell us a little bit about your book.
Well, here's my book.
Love it. Snafu.
It's someone just emailed me, another doctor, and he said it was a quick read. It was, it's meant to be fun to go through, that you'll get a few laughs. It's it's mostly a parody or a satire, but it's just that thing. There are a lot of crazy things about healthcare right now, and so doctors have to work in this kind of crazy world with all this absurdity, but they have to be competent, take good care of their patients, and have good outcomes, and it's just getting more and more difficult.
Yeah.
So maybe this brings out some of those things, and then you get a few laughs along the way. And there's some other more poignant little stories and vignettes about doctors and patients and nurses and things. So and some of those are actually I changed some things around, but they were inspired by things that really did happen.
Yeah, I love it. Thank you. Thank you so much for joining us today. It's been really fun.
Oh, my pleasure. Thank you very much.
If you would like to see some of Dr. Kent's work and those before and after photos, you can visit his website, briankentmd.com. His office phone number is 918-994-4100. And Dr. Kent's book, Snafu, is available on Amazon, Barnes & Noble, and wherever books are sold. Thank you as well to our listeners and viewers. I'm your host, Camille Diaz. This show is sponsored by Serenity Financial, a Five Rings financial agency specializing in financial education, living benefits, and guaranteed lifetime income. Be sure to follow MoneyHeart on social media at MoneyHeart Show and on our website, moneyheartshow.com. Today's money mantra is one that was provided by Dr. Kent that I just really love, and I think shows that little sarcastic personality that he's got going, which is one that I love. If a doctor gives you advice on how to manage your money, do the opposite. Thank you, Dr. Kent.
Thank you.